हेलो एवरीवन। सो अब तक हमने देखा कुछ सेशंस में व्हाट इज रिप्रोडक्शन, व्हाट आर द टाइप्स ऑफ रिप्रोडक्शन एंड व्हाट डज द रिप्रोडक्टिव सिस्टम ऑफ ह्यूमन बीइंग कंसिस्ट ऑफ। आज हम देखेंगे व्हाट इज रिप्रोडक्टिव हेल्थ। सो अकॉर्डिंग टू वर्ल्ड हेल्थ ऑर्गेनाइजेशन, good reproductive health means you are mentally, behaviorally, socially and physically well. You are well in all these characters, then you have a good reproductive health. क्यों? क्योंकि अगर आपको कोई स्ट्रेस नहीं है तो आपके बॉडी में ठीक से हार्मोन सिक्रीट होंगे। व्हाट आर हार्मोन्स? हार्मोन केमिकल मैसेंजर्स है जो ये आपके रिप्रोडक्टिव सिस्टम को कंट्रोल करती है। सो अगर आपके बॉडी में ठीक से हार्मोन सिक्रीट हुआ है तो प्रोसेसेस अच्छे होंगे। सो व्हाट आर द प्रोसेसेस विच आर कंट्रोल्ड बाय हार्मोन्स? इज लाइक फीमेल्स में ओव्यूलेशन, मेल्स में sperm development. So if you have a good reproductive health, your hormones will be good and therefore you will have good reproductive health. Good reproductive health does not only mean that there is no disease, there is good fertility. अगर आप fertile हो, कोई disease नहीं है, of course you have a good reproductive health. But ये सब characters भी आपके body में balanced होने चाहिए. So गवर्नमेंट ऑफ इंडिया बहुत सारे प्रोग्राम्स कंडक्ट करती है वे दे एजुकेट द पीपल अबाउट गुड रिप्रोडक्टिव हेल्थ. सो इट इज डन अंडर द प्रोग्राम कॉल्ड एज रिप्रोडक्टिव एंड चाइल्ड हेल्थ केयर प्रोग्राम. सो ये जो प्रोग्राम है ये इनिशिएटिव है गवर्नमेंट ऑफ इंडिया, जहाँ पे वो अलग अलग चीज़ों के बारे में आपको अवेयर करती है कि कैसे आप आपका रिप्रोडक्टिव हेल्थ अच्छा रख सकते हो. सो लेट्स सी व्हाट आर द इश्यूज ऑन विच दे स्प्रेड अवेयरनेस ऑफ. तो सबसे बड़ा इशू जो है गुड रिप्रोडक्टिव हेल्थ के बारे में इज बर्थ कंट्रोल मेजर्स. सो व्हाट आर बर्थ कंट्रोल मेजर्स? दे आर ऑल्सो कॉल्ड एज मेथड्स ऑफ कॉन्ट्रासेप्शन. सो ये मेथड्स इसके लिए अडॉप्ट किए जाते हैं टू अवॉइड प्रेगनेंसी. सो देर आर डिफरेंट टाइप्स ऑफ बैरियर्स. There are different types of barriers or methods which can be used to avoid contraception. So सबसे पहले जो mostly used method है उसको बोलते हैं physiological या oral devices. इसी को हम hormonal pills भी बोलते हैं. So what it is? It is physiological devices which are used in the form of tablets or pills. This is mostly used by females as a contraceptive pill. So ये पिल क्या करती है? ये पिल जो है इनमें कुछ हार्मोन्स है जैसे प्रोजेस्टेरॉन एंड ईस्ट्रोजन जो इनहिबिट करती है ओव्यूलेशन. ओव्यूलेशन मतलब जब एग्स फॉर्म हो जाते हैं ओवरी में, दे कम इनटू द फैलोपियन ट्यूब. सो जब ये पिल्स लेते हैं ये एग नहीं आता है फैलोपियन ट्यूब में एंड देयरफॉर नो ओव्यूलेशन टेक्स प्लेस. So therefore this is one of the most used contraceptive method by female. Pill Saheli is the most used contraceptive pill by females. ये freely available है कोई भी government hospitals में at free of cost. Next जो method है is mechanical means या barrier means. ये क्या करती है? It prevents egg and sperm coming together and fertilizing and forming the zygote. So कुछ बैरियर्स यूज करते हैं हम फॉर द मैकेनिकल मेथड्स. सो सबसे पहले जो ज़्यादा यूज होता है मेथड इज कॉन्डम. सो व्हाट इज कॉन्डम? इट्स अ थिन रबर शीट दैट इज यूज्ड एज अ कवर बाय द मेन फॉर द पेनिस. ड्यू टू दिस the semen gets ejaculated into the condom and not into the female's vagina. So this is the most simple and effective method. The condom Nirodh is available freely in all the government hospitals for men. So this is the most easily available and given free by the government for men as a contraceptive method. Next method which is used is diaphragm, cervical caps या walls. This is also made up of rubber and it is mostly used by females. So what happens is this also prevents the entry of sperms into the cervix of the female. Next method which is used is intrauterine devices जिसको IUDs बोलते हैं. So for this you need to go to the doctor or the trained nurses. They are going to put this plastic or metal object called IUDs into your cervix. That will allow fertilization to take place, but the blastocyst which gets implanted uterus will not happen. So therefore, this is one of the most used method by females जब उनको long term के लिए pregnancy के लिए नहीं जाना है. Okay, so this method will stop fertilization, but it will this device will allow fertilization to take place, but it will not allow the blastocyst to implant. So these are the different types of IUDs which are used: lip slop, copper releasing IUDs and hormone releasing IUDs. Next method is chemical means, जिसको spermicides भी बोलते हैं. So what are these spermicides? These are foam or tablets or jellies which are put into the cervix of the female partner. Sometimes it is even put into the vagina of the female partner. What does it do? If the sperm enters into the vagina, it gets immobilized and therefore it dies off after a certain period of time. But this may produce certain type of allergic reactions in the female and therefore it is not mostly used. Next method is the permanent method. इस method को surgical method भी बोलते हैं, इसको sterilization method भी बोलते हैं. So what are the two methods in it? First, vasectomy. So vasectomy is used by men. What happens is small part of vasa deferens is cut and tied again back. जिसकी वजह से sperms जो है, it cannot go from vasa deferens into the ejaculatory duct. Second method is tubectomy. This tubectomy is done in women, where what happens is this fallopian tube is cut and tied again. Now what will happen if the egg is released into the fallopian tube? It will be caught up here only and it cannot go into the uterus. So these are the two permanent methods which can be taken by a couple if they do not want to go for pregnancy. The most important awareness program is spread about medical termination of pregnancy. So what does it mean? If the woman is pregnant and she does not want the child, she can go for this MTP. So there are two cases in which the mother wants to go for MTP. First, if she does not want the child. Second, if the fetus has certain type of developmental problems, then the mother can go for this MTP. But very important is she can go only during first trimester of pregnancy. मतलब जब first 12 weeks है fetus development के, only during that time she can go for MTP. नहीं तो जैसे जैसे time बढ़ता जाएगा, it can be a higher risk for the mother as well as the child. So MTP is also called as induced abortion, and she can go for it when she does not want the pregnancy. She does not want the child, or if the development of the fetus is abnormal. The female alone can go for this MTP program without the consent of the male. Next, what is sexually transmitted disease? Sexually transmitted diseases are those diseases or infections which are transmitted through sexual intercourse between the partner. It is also called as sexually transmitted disease, venereal disease, or reproductive tract infections. So there are two major types of diseases included under it is syphilis and gonorrhea. ये दोनों भी जो disease है, it is caused by bacteria. Treponema pallidum causes syphilis and Neisseria gonorrhoeae causes gonorrhea. In both of these disease, bacterial disease, various types of symptoms can be seen. But the only preventive measure is spreading education related to sex practice, good sex hygiene. So overall, sexually transmitted diseases can be prevented if proper care is taken. So therefore, these are the different problems which are faced during reproduction, and to take good reproductive health, these measures are needed to be followed. Thank you, and very, very, all the best for your exams.